So my name is Arien Muzacz. My pronouns are she and her. I'm a clinical associate professor of counseling at OSU, and I am the primary investigator and project director for the Oregon Integrated Behavioral Health Training Initiative. OIBHTI is a HRSA-funded initiative. We received federal funding to provide training to increase the behavioral health workforce readiness of, in this case, our clinical mental health counseling students. The focus of this project is to prepare clinical mental health counselor trainees to work either in traditional integrated behavioral health settings in places like primary care clinics or hospitals or school-based health centers, where they get to work collaboratively with medical providers, or to prepare them to be that community link with their clients to other forms of healthcare. So it's really holistically bringing together mental health care and medical care. So many of the children, adolescents, and emerging adults in Oregon have very limited access to healthcare, and so integrated behavioral health is one way to reduce barriers to either accessing counseling or accessing medical care. So our trainees are in a year-long program. They're already doing clinical internships in community-based placements. These are community-based organizations, private counseling centers, county mental health offices, school-based health centers. And so our trainees are already learning counseling skills, focusing on utilizing the integrated behavioral health skills like screening, brief intervention and referral to treatment, how to do short-term trauma-informed counseling with bilingual clients or Spanish-speaking clients, so that we can increase access to counseling at younger ages. These trainees are also developing skills in being collaborators across various systems that clients are involved with. So they might partner with school counselors, with a primary care provider, with a specialty care provider to provide that kind of wraparound support to that younger client. Part of the reason this project is so essential is because learners in counseling and related fields are often required to take internships that are unpaid. With the student population that we work with, that's a really difficult ask. These are people who are supporting families, they are actively involved in their communities, and asking them to take a year and a half of their life away from paid employment to support an internship experience creates a cycle of graduate level debt that is really hard to get out of. The other part of this project that is so beneficial is that these trainees receive a training stipend that defrays a lot of those expenses of graduate tuition, of whatever other living expenses they might have while they're receiving this specialized training.